Hello, my name is Dr. Daniel Mazur. I'm a urologist here at Urology Associates. Today I'd like to provide you with a brief, informative video on the vasectomy procedure. I hope this can also serve as a reference for you for after the procedure as needed. A vasectomy is intended to be a permanent form of sterilization. However, it is important to know that a vasectomy is not an immediate form of sterilization. Contraception is still required until a post-vasectomy semen analysis is obtained after the procedure. Your urologist will discuss with you at the time of the procedure the timing of this semen analysis. However, this is routinely performed at about 3 months. It is important to use contraception until that is completed, or you may have an unintended pregnancy. Since a vasectomy is intended to be a permanent form of sterilization, men should be sure that they are done fathering further children. This is considered an elective procedure. There are other alternative forms of contraception if you so choose. While a vasectomy is intended to be a permanent form of sterilization, there's approximately 1 in 2,000 men who may have an unintended pregnancy even after a negative semen analysis with a vasectomy. If men do change their mind after vasectomy, it is sometimes possible to perform a vasectomy reversal or surgically extract sperm for in vitro fertilization. However, neither one of these procedures works all of the time, and they may be expensive. A vasectomy is considered a minor medical procedure that is usually performed in the office under a local anesthetic. If a different anesthetic is required, your urologist will discuss this with you at the time of the procedure. A vasectomy is generally considered to be a low-risk procedure. However, that does not mean there are 0 risks. Some bruising and swelling of the scrotum is normal after the procedure. There is approximately 1% risk of an infection or a hematoma. Additionally, 1% or less of men may experience chronic scrotal pain, which may affect their quality of life. A vasectomy is a procedure to obstruct the vas deferens. The vas tube carries the sperm away from the testicle into the ejaculate. By obstructing the vas tube, there will be no more sperm in the ejaculate once men have cleared that initial post-operative period. It is interesting to note that men will still ejaculate after a vasectomy, as most of the ejaculate fluid is prostatic in nature. Additionally, while the testicles and penis are close anatomically, this procedure should not affect the function of the penis. This includes urination, erections, and overall sexual performance. After your consultation with your urologist, if more than local anesthetic is warranted in your situation, it is imperative that you do have a ride home. Additionally, if you take any blood-thinning medications, it is important to stop these before the procedure. If you have questions about your specific medication, please contact the team before your procedure to provide instructions on when to stop. Generally, most blood thinners are stopped 7 to 10 days before a procedure. It is generally encouraged for you to bring more supportive underwear for the procedure. A standard no-scalpel vasectomy usually involves a small puncture in the scrotum. It is normal to have some discomfort during the procedure. However, your urologist will walk you through it and provide the local anesthetic. At the end of the procedure, the urologist may elect to place a small dissolvable suture on the skin. This usually dissolves in about 1 to 2 weeks. The vasectomy procedure itself is relatively short, on average approximately 15 minutes. After the procedure, we generally recommend icing of the scrotum. Most men do well with ibuprofen and Tylenol after the procedure. However, if prescription medication is warranted, your urologist will discuss this with you at the time of the procedure. Your urologist will provide you instructions at the time of the procedure for post-operative care. Most urologists will recommend you avoid showering for 24 to 48 hours after the procedure. We also generally do recommend avoiding swimming or soaking in a tub for approximately 2 weeks. It is also a good idea to refrain from activities that may irritate your scrotum for the first 1, ideally 2 weeks after the procedure. This includes running, biking, gym activities, and sport activities. It is also recommended that you refrain from ejaculating for 1 week after the procedure. Again, contraception is recommended after the procedure until a negative semen analysis is obtained to avoid the risk of an unintended pregnancy. After the procedure, it is common to have some irritation or soreness of your scrotum for the first 1 to 2 weeks. If you develop significant swelling or bruising that is concerning to you, please do not hesitate to contact your doctor. Additionally, if you are concerned about signs of an infection, such as fever or purulent drainage from your puncture site, please contact your medical team as well.